skin lesions. So now we are looking at what is the pustule. Pustule is nothing but it's a circumscribed lesion, and it contains nothing but a purulent material. Then what we see is the pyoderma. Pyoderma is nothing but any purulent skin disease. Then what we see is the scale. Scale is nothing but it is a flat plate, and it is nothing but a flake-like lesion. Flake-like lesion, and it is desquamated of the stratum corneum. Now looking at what is scar. Scar is nothing but it is a replacement by fibrous tissue or of any other tissue that has been destroyed by the injury or disease. It is destroyed by the injury or a disease. A scar, it can be an atrophic scar. Atrophic scar is nothing but it is thin and wrinkled. Then there is also a hypertrophic scar. Hypertrophic scar is elevated, and there is the excessive growth of the fibrous tissue. Now we are looking at what is sclerosis. So the sclerosis, it is nothing but it is diffuse, or it can be circumscribed induration, and this is nothing but of the subcutaneous tissue. It involves the dermis, and when the overlying epidermis it may be atrophic. Then it is characteristically seen as a scleroderma. Next we are looking at something known as the sinus. So in case of the sinus, it is nothing but a cavity, or it is also known as a tract, and it has a blind ending. Now moving on to the target lesions. Target lesion is nothing but they are less than 3 cm in the diameter. They have 3 or more zones. There are greater than 3 or more zones, and they are usually in the central area or of the dusky erythema or the purpura. It also has a middle pallor zone of edema. It has a middle pallor zone of edema. It also has an outer ring of edema, outer ring of erythema, and it has a well-defined edge. Next we are looking at what is a tumor. A tumor is nothing but it is literally a swelling, and the term is used to imply enlargement of the tissue. There is nothing but an enlargement of the tissue, and it is by a normal as well as a pathological material or cells that form mass of cells. Next, looking at what is an ulcer of a skin. Ulcer is nothing but the loss of the dermis as well as the epidermis. and it's often loss of the underlying tissue. Next, what is a vesicle and a bulle? So a vesicle is a vesicle. It is nothing but a circumscribed elevation less than 1 centimeter in diameter, and it contains a fluid. Then there is something known as the bulle. Bulle is nothing but it is greater than 1 centimeter in the diameter. Now moving ahead, there is something known as the wheal. Wheal is nothing but it is a transient elevation. Elevation of what? It is the transient elevation of the skin, and it is due to the dermal as well as the hypodermal, and often it is pale centrally, and it has a erythematous skin, erythematous rim to be specific, and it is the characteristic lesion of the urticaria.